welcome and to the Health Behavior and Community Health on Campus Capstone. This is exciting. Congratulations to all the students. A lot of hard work. You get a little taste of what public health is like. You know, hard work, collaboration, a little sweat and tears every once in a while. But good job. I know you've all worked really hard. And this is a special interest of me because I've had so many of you in a couple of my classes. So it's great seeing your progress over these past few semesters. And you've done it in probably the most difficult year I think anyone has ever experienced. So kudos to you for your flexibility and your patience and your hard work. So I also have to give a shout out to Dr. Liberatos. The instructor for this class is any of the capstone classes, but with this one is incredibly intense, and the amount of work that needs to be done, not only during the actual class itself, but also during the preparation period. So I know that she and I had talked, I think it was back in October, about potential projects. So this has been a long process for her as well. So thank you, Dr. Liberatos, for your help. I do want to introduce Dean Ambler, who is here. You can say a few words.
Sure, and everybody, it's great to see you. Thanks for all the hard work you've done. I look forward to hearing some of the presentation. I can't be here for the whole thing. I wish you all the best tonight. These capstones are just fantastic. And with Dr. Liberatos, I know you're all going to do great. As I told the students last night, I was the last skeptic in the school on whether or not to do these capstones instead of the other experiences we used to provide. It was a faculty idea that generated this system of capstones instead of doing a thesis at the end of the year or taking a comprehensive exam or some other culminating experience. I wondered how so many people working in the same project could pull this thing through and really pull something off that would be useful, educational, and valuable in the real world, as well as theoretically. And sure enough, year after year, public health students have done that under the guidance of our faculty. I am now the biggest convert because I was so skeptical. I was proven wrong, and I was delighted to be proven wrong. So this is a great process. I know it's a little bit tense when you first get started, but trust me, you'll look back on this evening with a lot of pleasure saying, hey, this was really something I don't get to do very often. So welcome, congratulations, and we'll see each other again at graduation. Thank you.
Thank you, Dean Ambler. I also want to acknowledge that Vice Dean Ben Johnson's here. I see also Dr. Ansel is here. Dr. Chen is here. I have to move the screen. I see Dr. Moskovich is here, Dr. Stambler. So we have a number of faculty, and if you're on the second screen of pictures, I might not recognize you, but I appreciate their support being here. So with no further ado, I am proud to introduce your instructor for the class and I guess the MC of the program, Dr. Penny Liberatos.
Thank you, Dr. Kittleson, and thank you all for joining us. Particular thanks to our deans, Dean Ambler and Dean Johnson, and we have other administrators here, Ms. Novotny and Dr. Ansel. And so thank you for coming. Thank you very much, Dr. Kittleson and Cindy Jakubowski that supports all of us. And thank you to educational media, particularly Michael Cotter and Michael Frankfurter, that make all of this possible. As Dr. Kittleson said, unless you are presenting, please keep your mic off. When you are about to present, turn it on. And now it is my privilege to introduce the on-campus capstone group, and Hala Kutbi will begin.
Hello everyone, this is Hala Kutbi. Today my classmate and I would present our capstone project of Behavioral Science and Health Promotion Capstone presentation about analysis of public health student experiences through a quality improvement lens, which has been made under Dr. Zbini's Liberatos supervision. In the second slide, my classmate student, including my name. In the beginning, I would like to overview what our presentation will cover today, starting with the importance of public health and quality improvement, especially in the workforce. Then we will move to talk about the method that we use to design our study and the participant who helped us to collect the information and the data analysis we collected from the participant, and we will end our project with talk about the discussion. We all know that public health is important to our society, especially because it helps public to make healthy choices, for example, preventing diseases and improve the quality of people's life. COVID-19 was a great example that made public health professionals, scientists, and researchers to work hard to maintain public health safety by giving the people all over the world the guidance to protect themselves against the virus. Public health is also important in education and training and in academic level also, by training the public health professional, public health worker to be a professional to meet the public health challenges. And in the academic, it helps the student to prepare to be more professional in the public health area to meet the future needs. Now I would talk about the process of quality improvement, which is actually depend on the efficiency and the ways to improve the area that need to be improved for meeting the customer satisfaction. For example, if it was implemented in the hospital area, it will make the patient more satisfied about the services they will get. For example, the accessibility to access to the healthcare. The quality improvement, the importance of quality improvement is also important because it's about making the system more effective for meeting the customer satisfaction, and it's also important to the student for making them satisfied after improving the quality of the education they will get and improving the area the area or the community where they will receive their education. Now I would talk about the context and the aim of our project. The dean actually of New York Medical College School of Health Science and Practice were interested to learn about public health student experience at the college. So he asked us as a Capstone group to survey these students for collecting and providing the data to understand the student experience at the college. So the aim is to collect the information from the student in order to enhance the student satisfaction in the academic setting. Now I would introduce the method of our project. After the dean requested this project from the Capstone group, we have submitted an electronic survey to all NYMC student School of Health Science and Practice in a total of 323 students who were registered for a course at least in spring 2021. Now I would like to pass the presentation to my colleague Sultan to keep going with the method. Thank you.
Hi, I'm Sultan. I'm going to continue the method sections. First, I want to describe the survey that we developed. So we are the Capstone student developed under our faculty members, and it was reviewed by our stakeholder, and final survey consists of 39 questions and 33 close-ended and 6 are open-ended. The survey consists of 4 general topic areas. As you can see, the first part focuses on aspects that were important. First of all, the importance in selecting a graduate public health program and selecting NYMC. Secondly, what aspects were important to them in choosing NYMC once they had been accepted. Next sections focus on the student experience at NYMC, looking at specifically at satisfaction. Then it will focus in academic learning preferences in terms of the different types of our learning environment. And finally, demographics. In beginning, we developed survey topic, then the stakeholder had given us some survey topic, and then we expanded on those. Then we had the stakeholder review them and approve them. And then we went on to develop the questions, so we drafted them, the questions. Those we reviewed by the stakeholders and make some comment, we revised them, and then when we had the draft survey with the questions, we peer tested with 16 graduate students, and we changed it accordingly. Okay, so now with the revised survey, the survey was converted to electronic survey, and we used Qualtrics link were sent to all public health students registered during this semester. 3 follow-up email resent to student non-response, and we reached out the STUI members and Saudi student clubs to encourage our fellow students to complete the survey. In addition, in order to encourage response, we have for 25 Amazon gift card, which were offered as a raffles participation. And by the way, the raffles will occur during the next week. Our data were collected in approximately 1 month from the beginning of March to beginning of April. Data analysis. Data analysis, most of the data that we collected is descriptive, so we are presenting frequency and percentage. We did make the comparisons between information demographic that we had for all public health students and for our survey response. We did 3 states of comparisons. We compare one on campus to online student, part-time to full-time, US to international. And for that, we use I-square and using SPSS. Okay, now for our result. So our overall response rate is 53% of a little more than half of the 323 students who were registered this semester. So one of the reasons why we are interested in the response, then we know at least the half of public health student register did participate in the survey. That is not tiny fractions of the entire group. So that the on-campus and online student participate equally well. As you can see from the graph, on-campus students were a little more than online student. Certificate student, not so much. So now when you look at the response rate by the degree in concentrations, as you can see, except for certificate, for most concentration area, about 40% of the student in each of those area responds to the survey. Not getting a degree, they respond at much lower rate than less 10%. There is for the health behavior and community health program, our program where almost 70 of the student response. And one of the reasons that occurred was because the people that were reached out, they were most likely to be students in our concentrations area, because those of students we know, which are mainly of students in this area, is probably the reason why we get the high response rate. Right now, I would like to pass it on to my friend Salim. Thank you.
Hello, everyone. Thank you, Sultan. Hello, everyone. My name is Salim Al-Balawi, and today I'm going to talk about demographic area of our survey responded compared to all public health students. The reason for doing this is because we want to ensure that our survey respondents don't likely slightly different when compared to all public health students. The pie chart on the left shows the gender distribution of all public health students, and the one on the right shows the gender distribution of our survey respondents. As we can see, the proportion of females is more than 2 times larger than the proportion of males, and they are both almost identical, which is great. Now, we have compared the race and ethnicity. The purple bars represent the survey respondent, and the blue one represent all public health students. we can see that a comparatively higher percentage of white and Asian students took part in the survey than their representation among all students. However, students that identify as other, like African and Middle East, participate at a lower rate. Hispanic students that participate in the survey were almost equal with all other Hispanic public health students. Also, Black students who responded to the survey were a little less in proportion when compared to all other Black public health students. Looking at the nationality, about 84% of all public health students were from the US, but only about 62% of the survey respondents were from the US, more than 2 times more international students responding to the survey in comparison to all public health students. Most of the other in the survey respondents identify themselves as coming from the Middle East. In this slide, participants based on on-campus student and online is shown. It appears that the survey respondent and the proportion of all public health students who are online were similar, but with the on-campus students slightly higher proportion when among all the survey respondents. The participant from the certificate-only student was very little comparatively. This is how the degree concentration of the survey respondent look relative to all public health students. It is pretty evident that the health behavior and community health respondent were larger portion of the survey respondent compared to the proportion of all public health students. And the certificate only, they were much smaller, although the overall percentage is only around 5%. Otherwise, otherwise they were pretty similar, and this is again similar to the respondent rate that Mr. Sultan presented earlier. I would like now to talk about the characteristic of all public health students that may be interested. So, where do our students came from? Not surprisingly, as we can see, almost 50% of the students came from New York State, and also not surprisingly, another 20% came from the northeastern area. Came from the northeastern region, primarily New Jersey and Connecticut. And another 20% came from Washington, D.C. and the southern area. The rest of the country, there are much smaller representation. Now, of all the degree offered, namely MBH, MS, and DRPH, most students were enrolled in the MBH program. In addition, many students also took certificate embedded with their degree, and the pie chart show the popularity of certain certificate. The health education certificate had the most students, followed by global health, industrial hygiene, emergency management, and finally public health. In addition, for public health certificate is not embedded, it is standalone certificate. Okay, so now I'm going to turn it over to my colleague, Mr. Al-Bahari, and he will continue this. Thank you.
Thank you, Salim. My name is Abdurrahman Al-Bahari. I'm also going to present just a few other characteristics of survey respondent that we had. So where do our survey respondents reside? You can see that 45% reside outside the New York metro area. Obviously, they're part of the distance learning program, and almost a third reside in the New York metro area, and they resided here prior to coming to campus. And the remainder, that 16% are in off-campus housing, and about 8% are in on-campus housing. So we took a look at respondents, working, and student status. As you can see, about 60% of our students are full-time students, and the rest are part-time students. And we are defining full-time as 9 or more credits. Almost about the same, just a little under 60% work full-time, about 10% work part-time, and a third currently not working. So how our students cover their tuition? About a third get a loan, and about a little under a third get a scholarship. The remainder, about a quarter, pay their own way, and about 15% have their tuition reimbursed by an employer. Now I'm going to move on to other findings. This graph on the left shows the number of public health programs that students apply to, and on the right is the number of public health programs that they were accepted by. You can see in the left that about almost a third only applied to one program, and about a quarter of students applied to 4 or more programs. The right graph shows that on average, almost equally divided between 1, 2, and 3, with a lower percentage of at 4 or more programs. This is the proportion of respondents who saw these various characteristics as important when they were trying to decide what public health program to apply to. And you can see that almost all of the students said that the school faculty reputation was important to them, followed by flexibility of course offerings and cost of attendance or tuition. These were the top 3. Then about 3/4 felt that the location of the school was important. Another 70% or so selected no GRE required. Then much smaller proportion felt that school size, housing availability, and lower TOEFL score accepted were important. There were 2 other things that were mentioned that are not included in these characteristics, and that was accreditation and fully online programs. So both of these were important to some students. Now, the same set of characteristics were presented to students, and they were asked which ones were important specifically in choosing NYMC. You can see that it turns out that the sequence is almost identical to the ones that I just showed you, with the exception of these 2, cost of attendance or tuition and school location, which were reversed in the previous slide. So in choosing NYMC, school faculty reputation and flexibility of course offerings were still important, but school location was more important, a little more important than cost of attendance or tuition. Again, accreditation and fully online programs were important to some students. Finally, we took a look at which characteristics respondents said were number 1 most important characteristics in applying to a public health program. And you can see here the sequence is no GRE, flexibility of course offering, school location, and tuition. Now, specifically in terms of selecting NYMC, the same 3 I just mentioned, along with lower TOEFL score, accepted. And now I would like to pass it to my colleague, Faisal.
Hello, everyone. This is Faisal Al-Kahtani. Today, I'm going to talk about proportion of survey respondents that was satisfied with certain characteristics of New York Medical College. So these characteristics are divided also to 3 categories: general, academic, and services. And I will go through each one in terms. So first, general characteristics, as you can see, supportive-friendly staff and also campus safety is particular rated very highly, where almost 80% of students were satisfied. Also, a little more than half of students were satisfied with the location in New York metro area, but less than 50% of students were satisfied with tuition cost and local cost of living, which is normally here in New York. Now we are going to talk about academic characteristics, which is the second category. As you can see, 70% or more of students were satisfied with all of these academic characteristics: the quality of virtual courses, on-campus courses, online courses, access to academic advisor, flexibility of courses offerings, student-faculty ratio, and library. All of those things, students were pretty satisfied with it. Continuing with the academic characteristics, as you can see on graphs, students were pretty satisfied with writing center and ability of transfer concentration. And on the other hand, we should note the last four categories or characteristics are career and academic guiding, field experience, research, and scholarship opportunities are less than of half of survey respondents were satisfied with it. And now we can move to the last category, which is the services. Parking availability and campus transportation, about 60% were satisfied. Starting with the international office and sales services, only about half of students were satisfied with it. And fewer of students were satisfied with access to health services and financial aid. Continuing with the services, fewer than half of survey respondents were satisfied with the availability of students and club, food and snacks on campus, off-campus transportation, and on-campus housing availability. In addition to the low satisfaction of snacks and food, most students, 70%, think that the snacks and food served on campus are unhealthy. In terms, we asked the student to tell us how interested they are about taking virtual classes. Almost 2/3 said they were indeed interested. Finally, we asked the student about classes format that student found to be the best for them in good learning. As you can see, little more than third, and the one that was most important by larger population of survey respondents was on campus, about 35%, with the others coming in just around 20%. The right graph shows preferred class format going forward, virtual and on campus, while online and hybrid a little bit less. Now I would like to pass it to my colleague Muhammad Al-Kahtani.
Thank you, Faisal. Hello, everyone. My name is Muhammad Al-Gahtani. I'm going to present some information about students' opinions and about the quality of different format of courses. So we are going to comparing online to in-campus and virtual for our survey respondents. So for the next few graphs, the green represent agreement with the statement, and the light blue represent disagreement with the statement. As we can see, about 16% of respondents felt that the quality of in-campus courses is better than online. A little more than half felt it was better than virtual. Virtual is better than online. We have again about 50-50 split, not much difference there. But when you're comparing virtual to in-campus, as we can see, about 3/4 of respondents disagreement that virtual is better than in-campus. About 3/4 of students disagreed that online learning is better than in-campus or virtual. We asked if in-campus was similar to virtual, about 17 disagreed with that, and then we asked whether students prefer live classes like in-campus classes. But they find that online is more convenient for the schedule, and as we can see, a little less than 16% agree with that statement. Now, I would like to make some comparing to in-campus with online students. We are going to present some information thus that differ significantly between on-campus and online students. So here, the online students are represented by the dark blue, and in-campus students are represented by the green. So we looked those important aspects when students were applying to public health program. What did they consider was important of them? And we see certain pattern of in-campus students felt that school location availability of in-campus housing and school size were important to them, while flexibility of in-campus and online courses offering was more important for online students. Looking at that aspects that were important to on-campus and online students after they were accepted and were important to their choosing NYMC. So again, as we can see, in-campus housing and school location were more important for in-campus students. Uh, and the flexibility of in-campus and online offering were more important for online students compared to on-campus students. Finally, we compared the number of public health programs that students apply to. As we can see, online students were much likely to apply only one school compared to in-campus, and this difference was also significant. Now, I would like to turn it over to my colleague, Mr. Abdurrahman.
Thank you, Muhammad. Hello, everyone. I'm Abdurrahman. I'm going to continue comparison of online students with on-campus students. I'm going to start talking about satisfaction. We can see that a large proportion of on-campus were satisfied with international office. On the other hand, online students were more satisfied with the quality of online and virtual courses, the field experience, and availability of certificates within the degree programs. Now, we are going to compare some of these characteristics of full-time student with part-time student. We are now looking at important characteristics in selecting public health program to apply. In this case, we can see that the part-time student were more likely to feel that school and faculty repetition were important, but in both group, it's more than 90%. So they both feel the same, but it's 100% for the part-time student. For the full-time student, they were significantly more likely to feel that the on-campus housing is an important characteristic because obviously they were more likely to be on the campus. Now, we are going to compare the level of satisfaction with New York Medical College characteristics. Part-time students were more likely to be satisfied with financial aid resources, parking availability, and off-campus transportation. This is opinion of full-time and part-time students on the best class format for learning. Full-time students were a little more likely to like on-campus and virtual as the best format for learning. Part-time students learning more towards online and hybrid. Now, I am going to presenting the comparison of the US and international student per certificate. Here, we are discussing which characteristics are important in selecting a public health program by national. For the next few slides, the pink bars represent domestic students and the gray bars represent the international student. According to domestic students, school faculty repetition and cost of attendance were the important characteristics. According to the international student, lower TOEFL score, accepted school size, availability on campus housing, and the school location were the more important characteristics. Here, we are comparing what characteristics are important in selecting New York Medical College after acceptance by nationality. According to the international student, a lower TOEFL score accepted was more important. On the other hand, the domestic student flexibility of on-campus and online courses offerings and cost attendance were more important. Here we are seeing the number of public health programs applied to by nationality. Domestic students were more likely to apply to one public health program. However, the international students were more likely to apply to two, three, four, or more than four public health programs. Now, I would like to turn it over to my colleague, Mohammed Mushahim, who will wrap everything up. Thank you so much.
Hi everyone, I'm Mohammed Mushahim. Today I'm gonna talk about satisfaction with NYMC characteristics by nationality. Looking at the characteristics, we can see that domestic students were significantly more satisfied with functional ID resource, student faculty ratio, cost of attendance, and location in New York City metro area. This completes our results section of the data presentation. In this slide, I would like to begin the discussion. I'm going to summarize the discussion by summarizing the findings that we have presented. The characteristics that were important to selecting the public health program. About 45% reported that only applied it to 1 to 2 schools, that who applied it to fair school, more likely domestic students, online students, or part-time students. The characteristics considered important by 80% or more were school faculty reputation, flexibility or on-campus online course, and tuition cost attendance. Looking at the program types, subgroups for online students, flexibility on-campus online course was important, but in on-campus school location and housing and size of school was important. Looking at the student subgroups for full-time students, housing and size school were important, but part-time school faculty important. Nationality subgroups, school faculty reputation and tuition and cost of attendance was important to US students, but for international students, location, school faculty reputation, lower TOEFL score. Moving on, focusing on the characteristics that students said that were important in their selecting of NYMC after they were accepted. Considered important by more than half responders were school faculty reputation, flexibility of on-campus online courses, wordings, school location, tuition and cost of attendance, and no GRE requirement. Here we are looking at how satisfied with the characteristics of NYMC. You may remember we broke it down to general, academic, and service. Some students were satisfied with 3 out of 5 of the general characteristics, 10 out of 14 of the academic characteristics, and 2 out of 10 of the service. You can see that the characteristics on the slide that we are at 50% or fewer students were satisfied. Looking at the preference for different learning formats, almost 2 out of 3 would be interesting to taking visual courses, and respondents is similar for all the subgroups that are on campus and online, full-time and part-time, domestic and international students. Also, the quality of on-campus deemed better than online and visual courses. Visual courses more similar to on-campus courses. Online is not better than on campus or visual, but it is more confident. This slide for limitation, even though more than half of the students responded to the survey, their responded did not certainly match those of the public health students. Students for one considered area responded to the international students are somewhat over represented. Also, perspective of criteria important to selecting public health program are limited to those who choose NYMC. We would like to recommend to our stakeholders that focusing on top 3 changeable characteristics that most students looking for when applying to a public health program. Then begin school faculty reputation, flexibility of on-campus online course, and tuition cost. Pay practical attention to the 14 NYMC characteristics that needing improvement. In addition to that, perhaps focusing on practical needs, concerns of the specific subgroups. Finally, we would like to say thank you for our stakeholders, deans of the School of Health Science and Practice, the chair of the Department of Public Health, Dr. Mark Kilson, the faculty advisor, Dr. Benil Bratis, and finally, the public health students. Thank you for all.
Okay, thank you so much. The floor is now open to your questions.
Outstanding, guys. That's great job. Could you, just for the people that weren't here or that aren't students, maybe visitors, could you define what you meant by virtual learning versus on campus? I think we all, the faculty know, but just could you give that clear description?
Okay, one of you. Okay, who talked about
Let's have Hala tell us. Hala, how about you describe
Okay. Okay, virtual classes is actually similar to the on-campus classes, but because of the COVID-19, we cannot attend to the campus and take the class face-to-face. So the classes tend to be online, live online. So we can talk and discuss everything with the instructor. So this is the virtual classes meanings.
Okay, good. Yeah, live via Zoom like we're doing here.
Yeah, yeah.
Okay.
Thank you, Hala. Okay, other questions?
There's a question that someone's asking.
Oh.
I'm just noticing it. Did you guys ask on the survey how students first learned about NYMC?
Actually not, we didn't ask about that. How student, can you repeat your question, please?
It's just like, I think the question was, did the survey ask students how they first learned about NYMC or New York Medical College?
Yes.
Okay. Do you know what some of the responses were?
Sultan, you were correct originally.
Yeah.
Go ahead.
Yeah, the response was, I think, 1 minute. The response was they learned from the reference, the first things, and most of them they learned from the other university when they apply to.
Okay.
Yeah, because the NYMC require like a specific requirement when you apply to.
Yeah. Okay, good. And just I think it's fair to say, whenever you do a presentation, you can't report every result of every question because this would take you an hour. So you've identified the key ones. So, but we will get that in our final report, which I know the dean's office would be very interested in. So.
Okay, other questions?
I have a question.
Yes, thank you, Dr. Kennedy.
Yes, great job, everybody. One thing I'm wondering, were you all surprised at all with the response rate? Meaning, did you anticipate more or did you receive higher responses than you thought you would?
Actually, we were glad that these participants actually answered our survey. Yeah, so a total of 323rd of NYMC of Public Health and Science Practice School, we got what we need from from them.
Great.
Yeah.
I think
Dr.
50%.
Kennedy, I can add something, please.
Go ahead.
Yes.
Yeah.
Sure.
So the first thing we send out emails. After that we get a response rate. We were not happy about that, and then we send follow-up emails for those non-respondent.
Great. And did those repeat emails help out a lot?
I would say yes.
Good. Great. It's a lot of work.
For a short
Indeed.
time. Dr. Chen
Yes.
has raised her hand
Yes.
for a question.
Hi, congratulations on completing your work. And I think I have all of you in my classes. So I think you did very good job. And I just have a quick question about what did you learn from this experience? I'm very curious because, I know Dr. Liberatos spent a lot of time, probably teaching you how to come up with a survey, how do you, engage in, how do you analyze the data. So can you, any of you, like, I don't want to pinpoint on anybody, but I know you guys can talk. So tell me what you actually learned and what do you plan to do afterwards?
Can I say something?
Yes, of course. Go ahead, Salim.
Yeah, thank you, Dr. Chin, for your question. Of course, every step that we follow with Professor Liberatos, we have learned so many things from the data analysis, the SPSS, and how to use the survey and how we can create our questions. Literally every step that we do, we follow. It was like a very huge step that we follow. It's a very big step for us that we can learn from it.
Can I add something too?
Yes. Go ahead, Abdurrahman.
So what Saleh mentioned, that's I would say that's academic experience. The other thing that I learned, it's the whole project is teamwork. I didn't work alone. We work with our stakeholders. We work with survey respondents. So yes, it's teamwork too.
Yes, good. Thank you. Anybody else?
I would done.
Okay. Any other questions?
Someone asked a question, and I'm just reading the chat because I know you're busy with other things.
Yeah.
One person's asking, does this course, do you think it'll help in the future to write and publish papers?
Yes, I can answer this if no one want to answer this one.
Yeah, go ahead, Hala.
Of course, it will help in publish a paper because it shows where is the weakness, for example, in the NYMC, and how can the NYMC as a college to improve the quality of the services which meet the student needs to make them gain more skills and to be more educated. So our project is about to study how to make the student more satisfied and where is the weakness in their thoughts. So the NYMC can start working on to improve the area that needs to be improved through using the quality improvement process, for example. That's it.
Okay, let's see. Are we getting more? Okay. Any other questions? Going once, going twice.
No, I just want to mention one quick thing.
Yeah.
Really good job, folks. Dr. Liberatos, my hat's off. I'm not wearing one, but hats off. But really a good job. But keep in mind that the job's not done till the paperwork is finished, because this written report is very important to the dean's office. So great presentation. You're going to be putting all that stuff into writing. So I see Dr. Johnson is wanting to ask a question or make a comment.
I don't have a question, but I do want to make a comment. So I'd like to echo Dr. Kittleson. This is incredibly important information for the Dean's Office. And I want to commend you all for the great work that you did. It is going to be absolutely invaluable to us in better serving the students going forward, and particularly in our efforts to recruit more students, both domestically and internationally. So it's a huge step in the right direction for us. So thank you so much.
Welcome. Okay, I think we were very glad to be able to do a project that was mutually beneficial, that it helped the students to learn this process of survey development, fielding a survey, collecting data and analyzing it. And at the same time, we were helping our stakeholders, which is, in this case, the school, but typically that's the way it should work, that the stakeholders benefit and the students benefit from the academic experience.
I think we're going to need to hire these guys as consultants to help our school-wide evaluation committee, because we don't get the kinds of returns on our surveys that they did.
You know, it was so thrilling because I know that I think it was Dr. Kennedy asked about the response rate. 50% on online is not bad. And I think they did 3 follow-ups, and that's what the literature shows with online. Anything more, you're not going to get any more, but 3 seems to be a magical number. And so I'm glad you guys followed best practices, and you got pretty good numbers, you know.
Right. Unfortunately, you know, electronic surveys in particular, but a lot of surveys these days are very hard to get people to respond to. So it took a lot of effort on the part of the students, on my part, to try to encourage and get that response rate. We were hoping to get it over 50%, so we just managed to do that. So we were happy.
Oh, just to share with you, I just read a review for a couple of journals, and I read a manuscript, and they had a 39% response rate, and they were thrilled. They thought, oh, this is fantastic. And I'm sitting there thinking, our students are better than that.
Yeah, that response rate is really important, and I was glad that we were able to get it over 50%. All right. If there are no other questions, then thank you very much for coming. We really appreciate it. And thank you again for coming.